successfully removed state-level criminal penalties for growing and/or possessing medical marijuana, and are in effect in Alaska, California, Colorado, Hawaii, Maine, Montana, Nevada, New Mexico, Oregon, Rhode Island, Vermont, and Washington. 10 states plus the District of Columbia have medical marijuana laws, which are laws that support medical marijuana but do not provide patients with legal protection under state law. I've chosen to argue that the state of Florida should legalize the use of medicinal marijuana. Marijuana consists of the dried flowers, leaves, and seeds and stems of the cannabis plant. These parts contain some compounds that usually produce the mind-altering effect that leisure users look for when smoking or ingesting the plant. However, they can also provide potential medical benefits. Marijuana contains at least 60 chemicals called cannabinoids. Researchers are currently figuring out how effective some of these cannabinoids can be in controlling symptoms of certain medical conditions. Recent research over the last few years suggests that the medicinal uses of cannabis and cannabinoids has the potential to make breakthroughs in the management of severe symptoms, such as pain, spasms, bladder dysfunction, and nausea, and could bring a dramatic improvement in the quality of life for many people with conditions including AIDS, Alzheimer's disease, various brain injuries, and some eating disorders, epilepsy, various mental illnesses, Tourette syndrome, and several more. Although marijuana has proven to be a slightly addictive substance and does have some controversial side effects, I feel that people who bear the burden and pain of having a disease in which marijuana can help relieve some of the severe symptoms should have the option of obtaining and using medicinal marijuana legally in the state of Florida. This issue is growing ever more important in today's society and amongst physicians throughout the country due to increasingly harsh drug laws and further research into how medicinal marijuana can help people. Marijuana works in a consistent process and can be either smoked or ingested. When either smoked or ingested, the THC and other cannabinoids in marijuana attach to two different types of receptors on cells in your body, which works a lot like a key in a lock, affecting the cells when attached. CB1 is one of the receptors and is found mainly in your brain, particularly in areas that control body movement, memory, and vomiting. This can explain why marijuana and the use affects both balance and coordination and can impair short-term memory and learning. Also why it's effective in treating nausea, pain, and loss of appetite. The other type of receptor is CB2, which is found mainly in tissue of the immune system, such as your spleen and lymph nodes. The purpose of these receptors isn't completely understood. They might serve as brakes on the immune system function, or also they might explain why marijuana can sometimes smother your immune system. After you smoke marijuana, its ingredients reach their peak levels in your body within minutes, and the effects can last up to an hour and a half. When eaten, the plant can sometimes be mixed with food, an example being the popular hash brownies. The ingredients can take up to several hours to reach their peak levels in your body, and their effects may last for hours. Presently, numerous studies and experiments have been put into action and proven that marijuana can relieve pain, nausea, vomiting, and help certain sufferers gain weight. Also, studies have confirmed that it relieves distress. People against the use argue that marijuana might weaken the immune system and sometimes can cause acute and chronic bronchitis. However, there have been very few reported cases of lung cancer or emphysema attributed to marijuana use. While there are other current substitutes to marijuana effective in treatments today, there's only one well-studied FDA-approved pharmaceutical included in those, and the amount of THC available in the substitutes consists of only one of the many therapeutical beneficial cannabinoids that are found in the natural plant. So many may ask, if marijuana is legalized as a medical treatment, should we also legalize heroin because it can help with side effects of insomnia? Studies have long established that marijuana is definitely less harmful than has previously been believed, and has recently proven to be better than even drinking in some cases. In 2002, an evaluation of roughly 7 separate studies involving 7,934 drivers reported that crash culpability studies have failed to demonstrate that drivers with cannabinoids in the blood system are significantly more likely than drug-free drivers to be culpable in road crashes. This result is likely because people under the influence of marijuana are consistently more aware of their impairment and balance it more accordingly than people on other substances such as heroin. Examples include slowing down and even focusing their attention easier when they can imagine a response will be required. This reaction is just the opposite of that shown by drivers under the influence of alcohol and other drugs, where drivers tend to drive more risky and careless due to their intoxication. Contrary to the popular belief that marijuana only weakens the immune system and can be equal to that of up to 20 cigarettes in one day, various experiments have shown that marijuana, in fact, can help slow cancer growth and help battle tumors. For example, in a 1974 study, researchers at the Medical College of Virginia, who had even been funded by the National Institute of Health to find evidence that marijuana does damage the immune system, found that the THC in marijuana actually slowed the growth of 3 separate kinds of cancers in mice, including lung cancer, breast cancer, and leukemia. Not too long ago, scientists in Spain repeated the same exact experiment and got the same results. Also, some of the latest in cannabis research, which was reported in a top science journal, explains in detail how cannabis can help kill tumors by cutting off their blood supply and protecting healthy cells. So another common fear of legalizing marijuana is the gateway effect and how it will affect kids, when in reality scientists have always had their doubts about the gateway effect, and currently have hardly any substantial proof to back it up. It has also been established that the use of marijuana as a drug is usually abandoned by people's mid-20s and 30s, and they quickly grow out of the drug. As far as the fear of kids' abuse of THC, I feel that the youth use of marijuana will significantly be reduced if it's legalized, because the dangerous appeal and reputation will be replaced with the understanding of marijuana as a medicine. The youth will see cannabis as a way of reducing vomiting and nausea in cancer victims rather than just a quick high. Although it has been observed to have some slight withdrawal symptoms, marijuana has only shown to have the magnitude of a nicotine withdrawal. Withdrawal symptoms can include cravings for marijuana, sleep difficulty, and weight loss, none of which are severe at all. Aggression, anger, irritability, restlessness, and strange dreams did increase during the abstinence period, but all effects can also be compared to someone's reaction to something as simple as a bad day at work. Unlike nicotine, alcohol, and other hard drug withdrawals, there is no one clearly defined withdrawal symptom, which is the trademark and stamp of a true addiction when marijuana use is stopped. So the question is simply, why not to legalize something that's going to help people? Although marijuana does have its flaws, I feel that in the world today, it would obviously do more good than bad. Marijuana, for medicinal purposes, would be a great breakthrough in medical treatments and therapies, and has been proven so in various experiments and studies not only in America, but all over the world. Over the last few years, marijuana has proven itself helpful in many ways and has taken a turn against its previously harmful reputation. The benefits of marijuana outweigh the consequences, and I feel it should be legalized for medicinal purposes in the state of Florida. Thank you.